Well, good day. I am Debbie Woodruff, representing LKN Connect. And I am so glad that you are here today as I engage in a stimulating conversation with Charles Boehly of Denver, North Carolina. He goes by Dr. Charlie, and he's the owner of WellBEing Chiropractic here in Denver. So thank you for being with us. And Dr. Charlie, thank you so much for taking the time out of your busy schedule to converse and share a couple well-being tips today.
Well, the pleasure is mine, and Debbie, thank you very much for having me.
And you practice a special kind of chiropractic care. It's neurostructural.
That is correct.
Tell us a little bit about what that is.
Well, neurostructural chiropractic is somewhat of a subgenre of chiropractic that focuses on the nervous system and the structural aspects of the spine. Mm-hmm. And the goal is to bring them to an optimum state.
And I believe I understand that your technique is more gentle than other techniques. So,
yes, I'd say in general, the approach that we take is gentler. We utilize instrument-based adjusting instead of the heavier, more manipulative style. We might use a very precise approach with pinpoint accuracy. As a former engineer, this is more of an efficient way of removing the obstructions in the nervous system, again, to allow the body to be in an optimum state and heal itself.
With everybody being so busy, efficient really resonates with me, allowing the body to heal itself. Now that's an interesting phrase. Can you expound on that concept a little bit?
Well, sure. First off, the body in general is always working to heal itself. If you ever wonder why, if you have a cut on your hand, why does it heal? Well, it does. We do take that a bit for granted. Anytime that there is any level of chiropractic or medical intervention, the goal is to remove the impediments or the obstructions to the body healing itself. At some point in our lives, our body completely fails to adapt and heal itself, and that's when we pass along out of this earth. But up until then, we need to do everything we can to remove those obstructions, and that's our approach, to remove that, to allow the body to work efficiently.
Yeah, so you're trying to help the body do what it knows how to do, what it does best.
Yes, and in chiropractic, we call that the innate intelligence. Basically, it means that, as we had said, it is always attempting to be efficient and interact with its environment the best it can. And I would say that that's the best definition of health. Mm-hmm. How well you can assess and adapt to your environment directly correlates to how healthy you are. If you can assess and adapt your environment better, you're healthier. If you can't, well, you're not. And that's probably the most advanced and efficient way of defining what health is.
That's really interesting. And I think it's very profound and yet very, very spot on, right? So if we're able to adapt, then we're not resisting. So every time we resist what's happening in our lives, or we brace, or we hold against, right? Whether that's a relationship or something physically that's happening in our lives, or a work situation, every time then we're obstructing the body's ability, the mind and the body's ability to really interact with what's in front of us in a way that's forwarding. Well,
I agree. And it's interesting, most of the things you actually mentioned are considered stressors. Mm-hmm. We're surrounded by stressors, and they all fall within three major categories: physical, chemical, and emotional-based stressors. Mm-hmm. And each of those has an impact on our existence. Mm-hmm. And some of them are helpful. For example, gravity, as an example. I mean, without it, we'd be in a world of hurt, of course.
We wouldn't be sitting here.
Well, that's true. But there are many that we can control and we can't. Later, we'll talk a little bit about some of the things physically we can control that will be helpful. I think that interact with your body during the day. But think also about the chemical stressors that are applied. Look at all the artificial colorings and flavorings and the man-made plastics and all of these things that have definable negative effects on the body. We'll touch on that too. And then emotional stressors, where we are exposed to so much stress, especially the last 5 years, that we've all been put under, and that has a demonstrable effect on how we operate and our overall health. So we'll touch on that too.
Excellent. I really like that. And so what I'm hearing, as you're talking, I hear an analogy in my head. We see our life as a highway. Mm-hmm. And we see all of these things as vehicles on the highway. So the physical things, the things that you mentioned, mm-hmm. emotional, chemical. Then the ideal is that the highway is clear and running. And we all know what it's like to be in a traffic jam. And we all have experienced driving, thinking we're going to get somewhere in a couple of minutes, and it might be an hour later before we get where we need because stuff is jammed. Correct. And so what you're saying from a chiropractic point of view, if we take that analogy, that with neurostructural, we're helping control and free up those traffic jams in the body so that the body can then heal itself and run the way that it's designed. Is that correct?
That is correct. And to take that just a little further, the conduit for everything in the body is your nervous system.
Okay.
All right?
Yeah.
We cannot replace that. We're going to replace most of the things in the body except that. And that is the avenue. Any level of obstruction of that is a less than circumstance.
Okay.
And so from our perspective, the goal is to identify the state of the spine, the nervous system, and work to bring them to this optimum state. We understand nobody's perfect, but there is what I call an acceptable range where the body should operate, allowing it to assess and adapt to its environment the best it can.
Yeah. We're sitting here with a spine, as you might be able to see. So my question is, do you have a name for your guy?
You know, I actually do not.
Okay.
I don't. This is probably the third or fourth spine we've had here. So I guess we'll call it 4.0.
4.0. Okay, I like it. And 4.0 houses a good portion of our nervous system, does it not? I mean, this is a very important structure.
Correct. The one thing that's missing here is obviously the brain, and that is a very critical aspect of the nervous system.
Yes.
But from there is the spinal cord, and exiting between each of the vertebrae are individual spinal nerves, and in some way, shape, or form, there is a connection from the brain to every cell in the body via the nervous system, whether it be directly innervated or through biochemical means. There is control, and there's the feedback loop. Again, very important that the brain tells the body what to do, but there needs to be the feedback from the body back to the brain to create that loop so that it can constantly, again, assess and adapt to the environment.
Now, in my reading, I've seen a lot of things where the gut communicates more with the brain than the brain communicates with the gut. I've also read that the heart communicates more with the brain than the brain communicates with the heart. So it sounds like our body is constantly taking in information. This isn't a perfect analogy, of course, but it's oversimplified, but the body is constantly taking in information through the gut, through the heart, through other, obviously our extremities, etc., sending it to the brain, and then the brain is as the master computer, is figuring out, well, what do I do with all this information, and then adjusting and sending out whatever chemicals and reactions, innervations that the body needs to respond to the stimuli.
Yeah, that's a great analogy. And to just take that a little further, if you think about the gut technically is an exterior environment. We are essentially a tube, and we bring food through, whatever, the water, etc., and our body takes what it needs and then excretes what it doesn't. And being a part of the environment, we need that to be as clean and clear of a signal to the brain so they can properly adapt. If there's any interruption or alteration of that signal, the brain can make an error. It can react improperly. And often this gets you off track and can lead to potentially illnesses, disease states down the line. And you may not notice when that starts until you've driven down the road.
And you look at a sign.
And you're just like driving from here to San Diego, and you made a few stops, and next thing you know, you're in Alberta. Nothing wrong with Alberta, of course.
Right, but you're going,
But it's not San Diego.
Shoot, I didn't end up where I thought I was going.
That's right.
So taking all that conversation into context, within chiropractic care, people are coming, having missed the road signs, going in the wrong direction, etc. So how do you help a patient who comes in and says, I just noticed my body isn't operating the way that I need it to, and all kinds of stuff is wrong?
Well, our approach is to assess the state of the nervous system and the structure, find where those are outside that acceptable range. And again, I'm simplifying this, there's much more technical aspects to this.
Yeah.
And then once we identify that, the goal is to identify what the patient's goals are, and then move in that direction. Typically that direction is to improve the health and well-being of the person and improve their performance, improve their capacity to assess and adapt to environment. At the end of the day, we want to lead to a better life, okay? More capacity and better interactions with the people in our lives. At the end of the day, that's what it really comes down to.
Yeah. So how does adjusting the spine or doing something along those lines, how does that lead to what you're talking about, a better relationship?
Well, great question. And we can keep this simple and we can go a little complex. I'll start a little simple. The nervous system is very sensitive to literally forces. There's been very interesting studies that talks about what does it take to obstruct a nerve. And they find that the pressure your eyelid puts on your eyeball, which is about the weight of a dime, applied to any nerve in the body will reduce its efficiency upwards of 63%.
Wow.
And if you stretch a nerve merely 6% more than its normal length, you can create a 70% obstruction. Now this is a little difficult to understand. What is 6%? But because the spinal cord attaches primarily to the spine directly at the upper and lower regions, as we're sitting here, we are stretching our spinal cord 10%.
Okay.
And I will offer that the reason sitting is observed as so bad isn't merely the static nature that we're not moving, although that does have some impact. It's that we're constantly stressing our nervous system. Okay? And so our goal is to identify where the obstructions are occurring in the spine that are interfering with that connection, and work through the spine to unravel that and to, again, remove that stress to the cord and the nervous system to allow the body to work more efficiently.
So really what you're saying is it's indirectly impacting relationships in the sense that, as you were talking, in the sense that if you have the obstruction in some form or fashion, then what I'm hearing you say is that when the body's more stressed, then you're just not going to react to the things in your environment in the same way as if you're more relaxed.
That is true. That is true. Sometimes we have no control on the stressors applied to us.
Absolutely.
And so
Absolutely.
you want that spine and that nervous system to be in its optimum state. Because if you have a stressor that exceeds the capacity to adapt, again, that's what leads to disease states and illnesses. And if it's so excessive, it can be catastrophic. So it's another way of looking at this is like a shock absorber in your car.
Okay.
The amount of travel afforded with that shock absorber is whatever it is. But depending on your environment, for example, if it's flat pavement versus going off-road, the more stress, which would be the off-road, you want more shock travel.
Yes.
If you don't have that capacity to adapt, then that can very much upset the vehicle, even causing it to crash. And that's a good analogy of veering off track and moving into illness and disease states. So yeah, that's the best way of looking at it.
You talked a little bit about how sitting is not, it adds a stress to us,
Sure does.
and it's different stress than when we're standing.
Correct. And so again, looking back at the anatomy, there are only a handful of direct attachments of the spinal cord to the spine. They exist in the upper cervical and in the pelvic regions. So much like a guitar, when you create stress on the cord with those, for example, sitting and stretching that cord or string, it changes the tone, and that can become obstructive to that. So when we're sitting, we're constantly pulling on the cord, which is literally pulling on the base of the brain. And there is a large body of research that not only is that having an obstruction to the neurological connection, but there's also the flow of CSF fluid in the brain that has to be brought through the cord, clean, very much like groundwater going through the earth, and brought back in. And that cycle needs to be maintained. And there's some very interesting bodies of knowledge that talks about the inability to do that can lead to some very interesting and potentially devastating cognitive issues.
Fascinating. So standing is better.
So standing is better, but you don't want to stand all day.
Right.
I offer that the best, if you're working in an office environment and you have the ability to stand, I call it the 15-10-5 ratio. Sit for 15, stand for 10, 5 move around, and there's your half hour. Okay, and that's the best cycle, and you're giving it the best variability.
Okay, excellent. So Dr. Charlie, tell us a little bit about some of the well-being tips that you share with your clients, with your patients.
Well, that's a very long list, and it is one of my missions to have an impact on every aspect of a patient's life. And I've broken down things into the things we need to be healthy, and we have to think about clean water, clean food, clean air, sunlight, okay,
Yes.
and movement. We have to move. So real quickly on those, clean water. There's a lot of garbage in the water. So if you can afford a reverse osmosis system, do it. Clean air. Get a HEPA filter, high efficiency particulate removal, very important. Food. Avoid as many of the artificial flavorings and natural, or what we call natural alternatives, but unfortunately they've been renamed the chemicals that we put. We have to avoid that. Avoid plastics and man-made things too. I want to add that in there. And then we need sunlight.
Yes.
Okay, vitamin D is critical. If you can't get sunlight, there are other avenues such as red light therapy, which have all the upside with none of the negative aspects of UV light. And movement. You have to move. Okay, your brain. We all are. Our 90% of our brain, in some way, shape, or form, is associated with movement in the body. Okay, and the body has to tell the brain what's going on, and there's a feedback loop. If you do not move, you are literally not feeding your brain. And your body will follow the use it or lose it, meaning that if you don't use it, a portion of your brain, it will not be used and it will shrink. So stimulate the brain by moving.
But so many of our jobs require work in front of a computer.
Correct.
And so we're not moving. It's a detrimental impact.
Well, indeed. And, that movement, that lack of movement at the computer, this is the world we've become, that extends to even phone usage. How many people do you see sitting with their head in flexion, looking down? What is that doing to the cord? It's stretching it further. So just a side note, if you're going to be on your phone, get your elbow underneath you and hold it this way so that your head is at least neutral. But taking that further, reducing your social media exposure is probably a good idea too. And we're all guilty of it.
Yeah, and that has a couple of advantages, right? So mentally, emotionally, excuse me, and then also physically.
Indeed.
So Dr. Charlie, can you please share with us some of your well-being tips that you would like for our viewers to latch onto for better well-being?
I sure can. We can talk about the physical aspect of it. As a former engineer, I was actually involved in a lot of ergonomics development in industry. And a couple of quick tips for your working environment.
Yes.
Okay, let's talk about that. Monitor needs to be that far away where your palm is.
Okay.
Elbows should not go forward of the plane of the body, including the mouse. The top of the monitor should be at the top of the head.
Okay.
Thighs parallel to the ground. Feet firm. That's the best thing that's 90% of the ergonomics right there.
Yeah.
You do those things, okay? Sleeping, posturing. I'm sorry for all the stomach sleepers. Get off of your stomach. 2 reasons. Increased pressure on your heart, not good. When you sleep on your stomach, you have to turn your head. In doing so, you compress the cervical spine, reducing the nutrification of the discs. You do that one night, not a big deal. You do this over a decade, it's going to lead to premature degradation of those discs. So how do you sleep? Back or side? I can't sleep on my back, but many people do. You want to make sure that you're flat, just a little bit of elevation, so a thinner pillow underneath the head, and a small bolster underneath your knees. If you're on your side, I really love body pillows. In fact, I use 2 because of my size. But you want to have that pillow between the legs, including the knees and the ankles. You see a lot of these small bolsters, but that puts your knee and ankle actually at risk. And then you want to hold onto a pillow such that it comes underneath your chin, preventing the top arm from coming across midline. You want to minimize the twisting or torque when you're sleeping. So that uniformity is very important. Lastly, about bedding, this is what you need to know. Firmer is better. You can always make a firm bed softer. You can't make a soft bed firmer. So get the firmest bed you can handle. And if you have to soften a little bit, put a little topper on. That's fine. Completely fine. Lastly, very important, make sure the head is neutral when you're on your side. You don't want to tuck that head forward. The fetal position was good when you're in your mother's womb, not so good when we're sleeping. The curve, because the curves themselves are critical. Cervical, thoracic, and lumbar curves are what allow us to have mobility and ultimately shock absorption. When you lose these curvatures, your ability to absorb shock and physical stressors is reduced. As a result, your body has to work harder by engaging musculature to absorb that. And of course, we feel that. And that's often what we see in the office is people will present with a lot of muscle discomfort, etc. And much of that is your body's attempt to mitigate what's going on with the structure itself. It's expending energy, which in my opinion is wasted.
And it's really about adapting, right? So because it's not working optimally, it's trying to manufacture what should be happening. And that's part of what you provide in the care you offer is getting those things to be in better alignment and have more a clear, clear communication between all of the nerves in the brain and all of the different parts. So
correct. And it's an amazing thing that the body can adapt. If you put your hand on a hot stove, I always say, is it a good or bad thing that you feel that? And the immediate response is emotional. We'll say bad. However, if you look at it from an objective standpoint, this is an unpleasant stimuli, and it prompts our body to move. If it were pleasant, we wouldn't move it.
So it's good.
So it's a good response.
It's a good response.
It's an unpleasant response that prompted action.
Right.
If you break that down. Similarly with the spine, your body will do these things to maintain its capacity to function. We still need that. However, that is erosive over time. All right, and that can lead again to chronicity of pain, syndromes, etc. And it's back engineering that to why the body has done these things. And that's what we're working to correct. Correct that spine so that it's more efficient, better connection, again, to allow your body to adapt.
From a chiropractic point of view, please share some of your well-being tips that our viewers can latch onto.
Well, I'd like to take it just slightly tangentially to some of the foods that we eat. Right? one of the biggest things we need to start to be aware of is inflammation. Okay.
Yeah.
Both primarily at a cellular level, and what we can do to minimize that. Now, inflammation can be very effective and helpful when we're healing certain things, as your body brings in reserves to heal any specific areas, how your body brings more elements to the area to allow healing to occur. However, en masse, an entire inflammatory state of the body is not a good situation.
Right.
And one of the best ways to minimize that is to reduce certain foods that increase inflammation and also increase certain foods that counter the inflammation. So very simply, omega-6 fatty acids, also known as linoleic acid, need to be reduced. Linolenic acids, which are more anti-inflammatory, which are known as omega-3 fatty acids, they reduce inflammation. Now, it's estimated that previous diets, when we were, think hunter-gatherer, we had a 1-to-1 or a 2-to-1 ratio of omega-6 to omega-3. The average American diet can approach 100 to 1,000 to 1, which means it's a very inflammatory state. The problem with inflammation is that it thins the cellular walls, increasing its permeability, and that can lead to a plethora of problems. So I know this is gets a little in there, but increasing your omega-3 fatty acids and reducing your omega-6 fatty acids are critical. So how do you do that? Increase your fish intake, and if you're concerned about mercury and things of nature, supplement. Avocados, nuts, seeds, etc. And then reduce the seed oils, which are processed. That's probably the biggest thing I can tell you is avoid all the oils except for avocado, coconut, and olive. Those are the only 3 that I would recommend that you consume. All the others were originally created for industry as industrial lubricants, as you know. Okay. The other thing is again, think about your water sources. Okay. I can't recommend enough moving into a reverse osmosis system. There's a lot of things that are added to water that are not helpful. Okay. There are many. We'll leave it at that.
What if someone has a well?
Well, I'd have it tested. Typically, wells I grew up on a well. I was very fortunate, and it was tested. It was very mineral rich. Okay. However, because of pollution, many things filter into groundwater, and you may not know it that there may be things in it that are not helpful for you. So definitely have that checked, I would say. Okay. When it comes to movement, it doesn't have to be CrossFit 7 days a week. You just need to move. Simply put, walking 20 minutes a day. There's a very good body of research now that suggests that merely rebounding, and the olds, remember in the 60s, 70s, and 80s, they used to have those rebounders, the bouncers, those actually work. Get on that for even 2 or 3 minutes. That can be very helpful from a vibrational standpoint. That's the vibration and sound is how your body exists. We are basically, we are moving not only globally, but at the cellular level, there's vibration. And there is some research that suggests that that's how those cells talk to each other, is through vibration through the cellular membrane. So move in any way you can. And if you can't walk very well, move the arms. Okay? Move what you can.
Yeah, even thinking about an office circumstance, maybe even walking during meetings. And I did share with the cell phone, about having it up about face height. So that's really awkward to hold a phone like that.
Yes, it is. I would offer though, it's just as awkward to look with it down this way too. I see that, and the other problem with holding the phone in this direction is what is that doing to the curvature here? It's reducing it. And when we reduce the curvature, you reduce its maneuverability. You reduce its ability to absorb shock, and you're pulling down on the brainstem. And none of that is good. So, yes, holding it this way is the best. All right, even better is just to put it down.
Well, there's that too.
There's that.
So, but maybe even a stand or something, because this, you have to get used to,
Sure.
Holding it like this, right? And often you're interacting with the phone, so you're using this hand or if you're left-handed, you're doing it in the opposite direction, but so then it makes it hard, but almost I'm seeing in my head, maybe when you can, have the phone on a stand so that you're interacting with it more ergonomically.
I mean, that's ideal. Jumping back to one other thing, this is very important. When you're sleeping, get the phone away from you. You do not want that Wi-Fi signal or that cellular signal near your head when you're sleeping. I would suggest turn it off or get it out of the room. All right? I know there hasn't been a ton of research on this just yet. But I foresee that that's going to be something down the line that will be identified. I would also add, don't use wireless headphones. You're having a radio signal that is just mere centimeters away from your brain. And I know many say that it doesn't have an effect, but they haven't looked at the duration of time.
Great. Anything else that you want to share before we close out our time together?
I think just look at all of the aspects of your life. And I understand most people can't incorporate all of these things at the same time. It's a lot. I get that. But every day, try to make better choices that are more naturally based. Okay? Think about your position in space, how you move. Okay? You're always better moving than not. Okay? And even if you incorporate a little bit at a time, this will lead into a better state. All right? You are the driver of your car, and your car is a Ferrari or a Porsche, depending on whichever you prefer. And you want to take care of it. So give it the right fuel, drive it appropriately, and make sure you exercise it. Make sure you keep it washed and cleaned, but also, what does that mean? Keep it aligned and make sure the electrical system is working properly. Again, that's analogous to the body. So also consider that even though you may have discomfort, it doesn't necessarily mean the body's doing something wrong. It's information. Understand why your body's giving that information and work to not remove the pain, but understand why and fix those problems.
So as Dr. Charlie said, it is about incorporating a little bit, a little bit, as much or as little as you can, but not judging yourself if you're not perfect about practicing all of these things.
I think it's so fantastic you added that piece in. I've been reading a lot of research lately, which I know you're well aware of, is how you view yourself, and again, giving yourself the grace. Negative thoughts have a greater impact on your body than you know, and on your general cognition and well-being. You have to think of yourself in a positive light. Okay, you will have more right than wrong in almost every circumstance, and I know you know that. And so just the thought and imagining and visualizing yourself being healthy goes a long way.
Absolutely. There's an ancient saying about, if a mountain is in the way, you can speak to it and tell it to go into the sea and it will be removed, which seems, logically ridiculous, but it's ancient wisdom that I think speaks to the power of words.
Indeed.
And it speaks to the impact that those words have. And when we talk about how we talk to ourselves, and if we're not practicing everything that we should be and so forth, instead of getting down on ourselves saying, I have an opportunity, I can do some things differently, and then celebrating when those things are done differently. And in that we shift, because words do matter, and there is science around that.
More than you know.
So
you know all about that.
There's a lot of science.
Words matter, and how you say things, what you say, not just verbally, but also internally.
Absolutely.
You have to have a very positive internal dialogue.
Yes.
And it's one thing that I encourage patients, and I know you do as well. Things always have the opportunity to get better. And
Yes.
But if you don't even consider that, you can't achieve that.
Correct.
So you have to open that door.
Correct.
I think you said that very well earlier.
Yeah, so
I had
thank
another
you.
saying. You're welcome.
Thank you, Dr. Charlie. We've learned a lot from Dr. Charlie today, some excellent well-being tips, not only related to our sedentary lifestyle and computers and phones, but also just general life tips around sleep and good chiropractic care, about movement, etc. So we've learned a lot. I hope that this has been helpful to you and that you're able to incorporate even just one thing and find an improvement in your life as a result. So thank you for being with us. This is Debbie with Lake Norman Connect. So also the owner of Breakthrough Wellbeing. And again, privilege and honor to be with you, Dr. Charlie. Thanks for being here today.
The pleasure was mine. Thank you for joining us today.
Bye.